This is Llewellyn King, host of MECFS Alert, which I produce in conjunction with Deborah Woroff, my friend in New York, who is herself a patient. I'm delighted to be able to speak now with Suzanne, Vernon, who is the scientific director of Solve MECFS initiative, which, for those who don't know, is the follow-on organization from the old CIVIDS Association of America. Welcome to the broadcast.
Thank you very much, Llewellyn.
Tell me, how did you come to be with the CIVIDS Association? You were there first before it changed its stripes, as it were.
Correct. I joined the CIVIDS Association in 2007, and we've changed our name to the Solve MECFS initiative this year. But I came from the Centers for Disease Control and Prevention after spending actually about 2 decades at the CDC. And the last 10 of that was focused on leading a research program for CFS at the CDC.
So you have a long history in CFS.
I do. I was actually at a research roundtable last week, and one of the patients reminded me that they had been following me for almost 2 decades, and I said, no, that can't be. And then I realized that, yes, indeed it was.
What does the scientific director do?
I identify the best researchers that can bring the highest quality expertise to MECFS to solve it.
And how do you apportion the funds for research? Is that a tough thing? Do you have people beating on the door saying, I want to do this, or I think we should do that? And are you the person who makes those decisions, or do you have assistants in making the decisions?
So when I joined in 2007, it was the first time that the association, the organization, had actually implemented a competitive funding opportunity. So competitive grant cycles. Before I came on, that's how it was done. People wanted to give money for certain types of research. In our competitive funding opportunity, we put out a request for applications, and our funding opportunity in 2008 was a broad one. We would take all comers, anyone interested in doing MECFS research. And in 2011, it was more focused. It was focused on biomarkers and treatment. And so we take respondents that way, and then they're all peer-reviewed. I mean, it was actually quite fascinating because in both funding cycles, we got about 60 letters of intent, about 35 applications with each funding cycle, and then all of those were peer-reviewed, and we end up with 6 grants in 2008 and 5 in 2011.
What is the average amount of a grant?
$100,000.
And that is over a period of years? Or
18 months.
18 months.
Yeah, so they're considered seed grants. They're, $100,000, doesn't buy that much research, but if designed well, it can provide great preliminary data so that the investigators can go on to apply to NIH or the Departments of Defense for more funding.
And you, Suzanne, your specialty is biological research. You're to put it in layman's terms, a bug lady. And you've been looking at these bugs, these CFS bugs, or trying to find them, probably more correctly, for more than 20 years. Are you encouraged or discouraged?
No, I'm encouraged. Anytime we generate data, it adds to the puzzle pieces on the table. So, any kind of bug data or infectious disease data or pathogen data that we get is an important piece of the puzzle.
Do you feel the disease is viral or something else?
I believe it's multifactorial. I believe infectious agents play a big part in triggering CFS, MECFS.
The whole field of biological research, because of the tragedy with Ebola, is that likely to get a boost? Is it likely to become a lot better funded and more to the front of the stove rather than being on the back burner?
MECFS?
All
infectious
infectious diseases. Are we likely to see a burst of enthusiasm for research, as we did with AIDS, which was devastating in the beginning, and then it got a lot of attention, and people with AIDS can now, survive normally if they take the medicines?
I think that's a very interesting question. You know, when I was at the CDC, it was always interesting to watch the way scientists dealt with acute infectious disease versus chronic diseases that have a viral component to them or a bacterial component to them. Chronic disease that's associated with a pathogen is a lot trickier to deal with. So I think maybe Ebola is probably going to just enhance the acute disease detection field for a while, just like what happened with SARS, just like what happened with West Nile. You know, these emerging pathogens come in, they do their deed, they, you know, we handle them, and then it's on to the next pathogen.
Do you feel that the solution, either a medicine or a therapy for ME, CFS, will come directly from direct research, or it could be happenstantial from something else, if you will, the effect of research into cancer or some other disastrous disease?
I think we have a lot to learn from other fields, and I think that has to be considered in light of also the data that we're generating for ME/CFS. You know, it's knowledge, and we have to figure out how to work together more collaboratively as researchers in science, and we have to learn how to learn from the rest of the knowledge that's being generated from these other fields.
There's a lot of criticism of how little money is spent by the federal government on ME/CFS. I think it's $5 million at National Institutes of Health.
Right.
I don't know what the CDC number is, but compared to other research, that's pretty puny. If you think that the nonsense of putting cold water over your heads generated more than $100 million,
right.
And some diseases have gotten huge federal funding that have been, for various reasons, Congress has liked them or supported them. How inside the agency does the search for money begin? Does it begin with a submission to the Office of Management and Budget, or a submission higher up within the agency? And how is it that for so long, so little money seems to have found its way to this large and dreadful disease?
I wish I had the answer to that, but we're not alone, if that makes us feel any better. There are many diseases that are medically unexplained that also get paltry sums of funding. So I think that we have to have that we have to take that as an opportunity to really do something about it, to really fund the kind of research that's going to provide the results, that seed funding that provides robust results, that allows investigators to go to the NIH with convincing preliminary data that the NIH cannot say no to.
Do you think that this disease needs, as some people believe it does, a presence in Washington, a lobbying presence, separate from your organization? Do you think that that would increase federal consciousness of the disease?
I mean, I like to use the example of what happened when XMRV was found. And when XMRV was found, and we actually ended up on the Hill, I think probably a month or so later, and we were talking to, I can't remember which senator it was, but on his desk he had the science issue, the October 2009 science issue that described XMRV. And he said, what are you guys doing about this? You know, this is a biomarker. So again, I go back to the fact that if we support the best research that can be done, and we work hard to identify a biomarker, then there's not going to be any turning back by the NIH or the CDC. It will be very, very beneficial all the way around.
Do you have any personal feeling? I know you can't really say exactly, but how long would it take from this period forward to find the biomarker which will be so seminal in our approach to the disease?
I think we have to go about it systematically. We're dealing with a complex disease that in a very heterogeneous population. So first we have to divide, we have to identify subtypes, we have to then characterize what's going on in these various subtypes. And the more we're able to delineate this heterogeneity and drill down into each of the subtypes, I think it's going to accelerate the rate at which we identify biomarkers. And I think there are some really good clues out there of what we can begin to look at once we are able to effectively divide that pie.
What are your feelings about the two drugs that have some beneficial effect for some people, Ampligen and Rituxan, which is a cancer drug that's used off-label? What are your feelings about those?
I think we should be studying people at many levels that are being treated with these drugs so that we can understand what it is that those drugs are actually targeting in those individuals and how they're working.
We don't know that at present, is that correct?
That is correct. That is correct.
We know more actually about how Rituxan works, don't we, as a cancer drug at least, in the immune system.
Right. I mean, it's kind of, yeah, that's right, that's right.
And yet there are people who swear by Ampligen and say they would be bedridden without it.
Right. Yeah, I know some of those people.
Yeah.
And it's true, it's very true.
So isn't it critical that very soon we find out what is working, what it is about Ampligen that works on some patients?
I think that is absolutely true, and I do believe that Hemispherics is continuing on with...
That's the company that owns the patent.
Correct, correct. With the studies that the FDA requested them to do, so that hopefully it'll be the first drug that's approved for CFS.
And finally, why has this disease so widespread? Everybody knows somebody who knows somebody. It's a fairly large cohort that we haven't seen any passion from the big foundations, which have often come in and made a big difference. The Rockefellers, the Fords, the Gates, they seem to have stayed on the sidelines. They don't seem to have been enticed into the arena. Do you think it's because we don't have maybe a celebrity like Elizabeth Taylor was for AIDS, or is it simply that maybe it hasn't been marketed correctly to the foundations, the need for sustained, substantial funding?
Several years ago when we had a briefing on the Hill, Scott Simon presented for Laura Hillenbrand, on behalf of Laura Hillenbrand. And you know, I had the great pleasure of talking with Scott before the briefing, and I asked him the exact same question. And you know, we talked about it, and I think it's just because there are so many problems in the world, and you're absolutely right. You know, how do you grab the attention of any one big foundation to really get the support that you're looking for your particular issue?
Well, in our small way, we're trying with this.
Yes, we are indeed. Yes, we are indeed.
Best of luck to you.
Thank you.
And that is our show for today. Thank you so much for coming along. We have been talking with Suzanne Vernon, the Scientific Director of the Solve ME CFS Initiative. This is Llewellyn King for ME CFS Alert. All the best. Cheers.